think I'll go ahead and get started. Just want to thank everybody for joining this call. I know some others will probably join in a couple minutes but just want to introduce myself to everybody. I know many of you on this call and others are not so familiar faces, but I look forward to working with you moving forward as we launch and administer this competitive grant program. So my name is Catherine Martin. I'm the Vice President for Health Affairs here at the UNC System Office. And in the 2023 State Budget Act, we have been given a generous $8 million recurring appropriation for the system office to establish this rural residency medical education and training fund. Today, I'm just going to walk through with you the different grant types that will be administered through this fund, just the different application and application deliverables that are required to be part of the entire application when it's submitted. And I'll also pass it off to the SHEP Center. This has been a partnership with the SHEP Center as well. They'll be providing all grantees technical assistance to implement their rural training programs. So today's agenda, I'll talk about the rural training landscape, just give you a brief snapshot of what's going on across North Carolina, and just thank all of the homegrown programs that have been launched and sustained with philanthropic funding, other generous state appropriations, federal appropriations, but really talk about the federal limitations too briefly of how, while there is such good work going on in the state, and really I've learned so much from all of you on this call about all the good rural training programs that you're operating, but just talk about some of the federal limitations that prevent expedited growth in this area, if you will. So then going to transition to talk about how this fund has really been designed, again, in partnerships with this technical assistance GME team housed at the SHEP Center, to really bypass these federal obstacles and to deploy funds faster to get faster outcomes. And then after that, I'll be handing it over again to Mary Alice Scott, and she'll be talking about all the technical assistance resources and tools that she and her team, expert consultants who have worked with over 45 states for the past couple of years, more than a couple of years, really, establishing and sustaining these types of programs to actually help people implement these programs in a sustainable way. So a quick snapshot here of North Carolina's rural training landscape. This fund is really targeted on the 6 high-need specialties, really focused on primary care. There's also general surgery and internal medicine in the mix. But this is a recent report that was produced by the SHEP Center a couple of months ago, and it looks at what does the post-residency retention look like for practicing physicians across the state, across these 6 high-need specialties? This is something the SHEP Center has been tracking for years and years with their expertise, just merging different data sets with ACGME data. And it looks at how many are actually staying in state. We're probably really in the middle of the pack, actually, for physician retention compared to other states across the nation. But when it actually comes to rural practice placement, 30% of North Carolinians live in rural areas across the state, and probably fewer than 3% of these 6% of these 6 high-need specialties are actually practicing in these areas. And so what this fund is really, and the mission of this fund is to build out the existing rural training landscape today and to make it easier for programs to launch and sustain these types of training programs. And then we briefly talk about the federal barriers to rural residency programs. We all know that Medicare and Medicaid are the 2 biggest payers when it comes to graduate medical education, GME reimbursement for residents. It really boils down to facility type and geographic and rural training time limitations at the federal level that make it onerous or just difficult for certain types of facilities to start and sustain these types of programs. For example, if you're a critical access hospital, they often need an urban partner to be able to acquire full GME reimbursement if they want to have more residents train at a rural area, which a critical access hospital often is located. Sole community and Medicare dependent hospitals don't receive the full GME. Oftentimes it's the direct component of full GME. They don't get the IME payment. And then community-based healthcare settings like federally qualified health centers, funds from the federal government they usually do not directly funnel to them if they were to sponsor a residency program in a rural area. And then there's also the geographic and rural training time limitations. At this moment, CMS defines rural. The entire county has to be rural for where residents are training in order to get full or the CMS reimbursement. And then not only that, but over 50% of a resident's training time needs to be located in that area to get GME reimbursement from the federal government. And so here comes the fund, the Rural Residency Medical and Education Training Fund. This is an $8 million recurring state appropriation. I stress the recurring because I would say that this is pretty unprecedented in previous state budgets for there to be recurring dollars specifically for residency training. There may have been some given to specific entities, but from a system-wide perspective here at the system office, this is new for us, and we're very excited to partner with the SHEP Center to deploy these funds and to assist all of you with all of the strengths that you bring to the table on this call. So the goal clearly is to strengthen the rural physician workforce, keep healthcare closer to home for more patients living across these rural areas. Like I said, the objectives with how this fund has been designed is to bypass the federal GME obstacles that are currently in place. For example, like I said earlier, over 50% of a resident's training time needs to be in a defined rural area. We are actually relaxing the training time requirement from 50% to 30%. And we are also relaxing the definition of rural to include HRSA's Federal Office of Rural Health Policy definition of rural, which ultimately means you can be training a resident in a county where there's urban areas, but there's also rural tracts as well, rural census tracts. And we've also included the North Carolina Rural Centers definition as well. And the goal of this is really we feel like there's so much untapped rural partnership and capacity to be able to train residents in more areas across the state outside of the federal definition and still operate a sustainable program with these recurring general fund dollars. And then, while there are federal impediments, this is also an opportunity, depending on how you wish to strategize the use of these dollars to sustain programs and to train a rural physician workforce is you could easily leverage these state funds and ultimately be sustained by Medicare if you are in fact located in an entire county that's considered rural by them and be able to train physicians over 51% of their training time to be sustained in the future. So this fund is targeting the 6 high-need specialties: family medicine, peds, psychiatry, internal medicine, general surgery, and OBGYN. And now I'm going to walk you through the different types of grants that will be administered from this fund. I will say the first 3 grant types, development, expansion, and sustainability, they're purely GME focused. Innovation grants can incorporate GME, but they can also be separate from GME. You could have UME, you could have medical students training. An example could be a form of interprofessional education where you have medical students training with dentists, training with pharmacists, nurses, any innovative, different alternative healthcare delivery model that partners want to come up with as one application coming in, we will look at that. We're intentionally being very broad about innovation grants, but let me just unpack from the top here, starting with development. So a development grant is up to 3 years of funding. That's the max grant period to use these dollars. The max award amount is up to $750,000. This is not a renewable grant. Development grants really are to start from scratch a new accredited residency program. So something that is completely brand new, has to go through the accreditation process. This takes a lot of intensive time and resources, largely protecting, buying out faculty time, people to be a program director, program coordinators, just the logistics involved to put everything together, the expensive accreditation fees that come with developing a brand new program. And then we move on to expansion grants. An expansion grant is for applicants who are interested in building out rural training curriculums for residents within an existing accredited program. For example, you already have an accredited family medicine program. You want to build out a rural rotations, rural partnerships that add up to 30% training time. This is where you could apply for an expansion grant where you're recruiting residents, and that amounts to $150,000 per resident per year. And that $150,000 is really a benchmark number, similar to what federal grant programs offer, similar to really just, the expertise of the SHEP Center's GME technical assistance team when they're looking at costs as they have it helped other organizations expand their residency programs in prior years. There's also sustainability grants. These are annual renewal, dependent on outcomes, just like expansion grants are. And sustainability grants are really, it's like, in summary, a gap funding grant. So, if you look at the facility type you are maybe, and you're training residents and you need gap funding because you don't get full GME reimbursement, this is an opportunity to sustain the existing physician workforce pipeline that you're building out. And then there's also the innovation grants. Like I said, this could feature things like interprofessional education, which is why we've also opened up an eligible applicants, which is also what the budget language allows for UNC constituent institutions health affairs programs to apply or to partner with others on this call. So moving on to eligible applicants, this is listed out in the actual RFP document. We will be sending this out at the end of the call. In addition, like I said earlier, with all of the program or the application deliverables. But in the RFP document, this is spelled out: ECU Health, inclusive of all hospital system locations, UNC Health with their hospital system locations, ECU Brody School of Medicine, UNC School of Medicine, any regional AHEC that demonstrates a partnership with ECU or UNC Schools of Medicine or health systems, and any UNC system constituent institution health affairs program. The funding parameters, I've mentioned this a couple times before. For GME specific grant applications, they must focus on any of the 6 high need specialty residency programs that I went over. Again, they must include at least 30% training in a rural area. We've defined rural, we've relaxed that definition. That's also spelled out in the RFP document. They must include a viable sustainability plan, and they must include a partnership with at least one community-based ambulatory care center located in an eligible rural area. The innovation grant applications may or may not incorporate GME training. I've talked about these different grants, but just to reiterate, development grants up to $750,000 across a 3-year period to establish a newly accredited rural residency training program. These are non-renewable because the thought is of how we've structured this fund is, once you have developed it, you could move on to leveraging state dollars to sustain or expand these programs that you have been able to develop, or you might just need a development grant in order to be sustained by Medicare or CMS, federal CMS GME dollars in the future. Expansion grants up to $150,000 per resident per year. This really focuses on complement increases or establishing new rural training sites within an already existing residency program that is one of the 6 high need specialties. And these are also renewable. Sustainability grants, there's a lot going on this slide, but ultimately it really is gap funding. And there will be a financial assessment that's required as part of the application. And this is something that the Technical Assistance Center will, advise and look at closely with their experience. And lastly, the innovation grants. These are up to $200,000 total for up to a 2-year period. And they could be pilot projects. Again, it could be a rural fellowship. It could be GME. It could not be GME incorporated, but they're designed to improve healthcare provider retention in rural areas through unique healthcare delivery models. And as part of these innovation grant proposals, they need to have, you know, defined metrics. How would you define the effectiveness of these types of pilot projects that you're putting together? For grant application deliverables, you can submit your proposals to me. That's my email right there, the UNC system office. And then the proposals must include the following grant application deliverables as the cover page, a narrative. The narrative is no more than 5 pages. Sustainability plan, a work plan template, work plan ultimately meaning who's assigned to what objective to meet your overarching goal. Then your budget, there's budget templates. There's 2 different types of budget templates that you'll see. And then there's proposed rural training sites, letters of support, readiness assessment, and then baseline residency program data. Because ultimately we want to, you know, with the existing data that we have at the SHEP centers, we want to build upon that. Self-reported data is so key here for better accuracy as this program grows out in the future. And then before I transition over to Mary Alice for her to talk about the technical assistance tools that they will provide to all the grantees, that, you know, there has been there's proven solutions, right? With federal funding, direct federal grant fundings, rural residency program development, THC GME grant programs from the federal government that have helped target funding for really the establishment of new rural training programs. CMS does not cover the cost of startup funding. And we're taking the characteristics really from the federal government grant programs, what other states have been doing, specifically New Mexico, Wisconsin have really strong rural residency program grant funds with general fund dollars like we have here in North Carolina. All of that combined together, even with North Carolina, all of the great things that are happening across the state now that have either been self-funded or philanthropically funded, this all goes into how these types of programs have really taken off over time. And I just wanted to show that chart because the people on this call who will provide technical assistance have really been a part of this growth. And I just want to thank them for that. And so since you have the SHEP Center's Technical Assistance Center, their GME experts on hand, you know, we are requiring that you engage with them proactively. They can really assist you with looking at hospital cost reports, seeing if there's funds that could be potentially left on the table, if you know, with all the federal rules and regulations around GME that, you know, a hospital may not have been aware of, other than just helping you guide and implement the programs that you receive grant dollars for. I mean, there's so many other external factors that they have knowledge about that they could really assist you in sustaining your programs or building out programs even faster than you thought you could. So we really request that you work very closely with the NCGME Technical Assistance Center. As far as grant program timeline, the application deadline is January 20th, 2026. We will conduct an internal review process between January and March of 2026, and then we will issue award notifications and funds between March and April of 2026. We will also have annual reporting requirements, which is included in the RFP document. And then, like I said, there will also be required technical assistance center assessments for active grantees. So there will be quarterly assessments that you'll need to comply with as part of receiving and implementing these dollars. So now I'll hand it off to Mary Alice, the Deputy Director at the North Carolina GME Technical Assistance Center.
Thank you, Catherine. Welcome everyone to this webinar. I'm so excited to see so many people on the webinar today. I want to share with you all just for a few minutes the resources that we have available at the Technical Assistance Center to support you both in the pre-application phase as well as once you are a grantee. So let me start There we go. So first, I want to start by giving you a little bit of background about our Technical Assistance Center. This Technical Assistance Center was established in 2024 with a vision that all North Carolina communities will have access to the high quality medical care that they need as close to home as possible. And that's something that we cannot do alone. Obviously, we need a lot of other people to support that. But our piece of that is to provide specific technical assistance for the development and sustainability of rural training in the 6 high need specialties in North Carolina, as well as the additional health workforce training that we need to be able to provide that high quality care close to home. So we are one of 4 technical assistance centers under SHEP's GME. These include the Rural Residency Planning and Development Technical Assistance Center, which was established in 2018. The Teaching Health Center Planning and Development Technical Assistance Center, which was established in 2021. And then finally, the Teaching Health Center GME Technical Assistance Center, which was established in 2024. And so when you look at this, we have many years of experience providing technical assistance for development and sustainability of rural and teaching health center programs nationally since 2018. And this foundation has allowed us to build a really strong team of advisors and consultants with experience both in North Carolina and nationally. And so each grantee will be assigned an advisor and consultants as needed, depending on program goals. And our TAC staff will support coordination with those advisors and consultants. We will also be conducting research, reporting, and evaluation. And we'll be developing and sharing resources with you all to support your goals as you move along in your program development and your innovation processes. So today I'm going to share with you some of the main resources that we have available to you now to help you prepare your applications. So first, we have our NCGME website at ncgme.org. This includes information about our team, a list of North Carolina residency programs in high need specialties that currently do substantial rural training, as well as information about how we can support you in program development, expansion, sustainability, and innovation. And we also invite you to follow us on LinkedIn at North Carolina GME. We are regularly posting there opportunities, program successes, and new research that's relevant to rural health workforce. Very soon, this website will be directly connected with our national resources, but you can already access those national resources. And you can access those through our one of our other websites, ruralgme.org. So if you do not already have an account, you can create a free account by clicking on the I have an account button. Once you've done that, you'll be able to log on to our portal and you'll have access to a number of resources that can help you with your application. And then later on with your program that you applied for as a grantee. So once you've logged into the portal, you will see a page that looks like this. The portal includes a getting started page that has a recommended timeline for rural residency development, a toolbox that is full of resources and recorded educational sessions, and the hospital analyzer tool that can be really helpful in determining funding eligibility. So I'm going to go through each of these quickly and share with you some of the new things that we are in the process of developing as we're expanding our technical assistance center to support rural health workforce training more broadly. So first, our rural residency roadmap is one of several roadmaps that we have developed or are in the process of developing. This is a great resource for program development proposals. We also have built a dental roadmap that is available at one of our other partner websites at thcgme.org. And we are building workforce development roadmaps across other disciplines. And I really want to highlight what Catherine mentioned earlier, that the innovation grant includes interprofessional and other health affairs programs. And so these new workforce development roadmaps will support those types of programs as well. We also have our portal toolbox resources that are organized by different domains of program development. These are filterable and you can search for specific resources using any word or phrase. But there are some key ones that I want to recommend as you're developing your proposals. I won't read through all of these. You will have access to this recording and to these slides so that you can take a look at these as you're developing your proposals. We are also happy to help you locate any other resources that you might need, and we'll share those new resources as they're developed through our listserv. And so I do also want to say, if you've not yet joined our listserv, please feel free to put your email address in the chat and we can get you added to that listserv so that you can learn more about new resources as they're developed. There are over 360 resources available in our toolbox. And so there are resources for nearly any question that you may have related to program development, and we're happy to help you find those if you need help with that. The hospital analyzer can be found in two places. One is on the portal homepage, and then also on the top of the navigation bar. The hospital analyzer is a tool that provides a high-level overview of various considerations for GME for every hospital in the country in both urban and rural areas. And the GME analyzer is a tool you can use in your application because it provides information about the implications for graduate medical education based on hospital category and location designation. And I'm going to walk you quickly through what that hospital analyzer looks like so you have a sense of what information you can find there. So first of all, to walk you quickly through this, you can click on one of the states in the analyzer filter that's up here at the top left. And I also, before I jump into the specifics about this, I want to really highlight what's in this green box. There is a glossary that our team has developed in collaboration with CMS, the VA, and IHS. And it's a great resource to better understand different hospital types, GME finance terminology, and program types that are relevant for rural training. But in this example, we clicked on North Carolina. And so you can see there's a list of all of the North Carolina hospitals. You can filter by the specific community that the hospital is located in. And then once you click on one of these hospital locations, you will see a page that looks like this. This PDF will download for you. This provides detailed information for every hospital in the country that filed a cost report. So that's where this information is coming from. And so you can see key information about the hospital and the various funding implications. GME funding is complex. If you need more information about this, we do have a webinar in our toolbox that I highlighted earlier that's called What's New with Rural GME Financing. At SHEPS, we are also currently working on updating this analyzer with new CMS and FORP rural data that has just recently come out, and that will be available within the next couple of weeks. Grantees will also be able to access a range of different types of support through our Technical Assistance Center. So this slide just summarizes the support that we will provide you as a grantee. This includes new program planning, assistance with GME finance questions and financial planning, best practice resources through our toolbox, support for your GME office staff, informational meetings, both as through our national work as well as specific to North Carolina. And I'll talk about the specific to North Carolina a little bit more on the next slide. Assistance with accreditation, including review of applications, mock site visits, connection to our national faculty development resource, and advice on recruitment and marketing strategies. And I want to specifically highlight our North Carolina-focused program development learning network. Everyone is invited to attend these sessions, whether you're a grantee or not. You can learn more about these sessions and receive invitations through our listserv. So again, another plug to put your email in the chat if you would like to be added to our listserv and receive more information about these sessions. All of the sessions are recorded and are available on our NCGME YouTube channel. We just had a really great session at the end of September with Deb Clements and Dan Ellswick, who are national experts in a range of high-need medical specialties, and focus their talk on rural faculty recruitment. So that recording is available now on our YouTube channel. We also have several upcoming sessions that you can see on this slide. We welcome you to propose topics that you would like to present or that you would like to learn more about. We have a huge network across the country of experts in probably any topic that we can think of. And so we are happy to put together a session on topics that are of particular interest to you. If you will just let us know, you can email us at info@ncgme.org with any ideas that you have about upcoming sessions. And I will turn it back over to Catherine.
Okay, so here we have contact information on this slide, and then I'd like to open it up to any questions that anybody has.